Hey everyone, OT Life Hacker here. Today's topic is what happened when I asked a staff member in the hospital for assistance. Now, keep in mind, this story that I will be sharing is not in any form representative of the setting, of the workplace, of any place for that matter, because such situations can happen anywhere, and they are possibly rare things that happen because of something that happened in the day or something that's going on for that person, but they are how do I say, we'll just say they're not representative situations or maybe even behaviors of a person, of a place, of the place they work at. So do not at all, as I'm sharing this story, do not at all think, oh my gosh, that place is a horrible place. No. It is not the case. It is simply interactions that can occur when you are working with others, when you are simply talking to others, maybe when even talking to a friend or someone you just met or someone who, like the cashier or something. These events, the event I'm going to share with you, can happen anywhere. And maybe it even happened to you, or that you had done this and this behavior towards someone else. But don't take it to heart. It's always learning experiences, for sure. So what happened when I had asked a nurse for help in the hospital? I am a level 2 fieldwork student in the acute care hospital right now as a fieldwork student. As an occupational therapy student. So in occupational therapy in the acute care setting, we help with helping a person get up out of bed so that they can do their activities of daily living, which is brushing teeth, washing hair, brushing hair, taking a bath, washing your hands, and anything that has to do with daily things you do that are important to you, and maybe something happened and you're not able to do it as well as before. So OT is there to help you. Yay! So today, I had been working with a patient who, she was sitting up in a chair when the OT and I had come in. The OT left to go get some supplies, and it was just me and the patient. The patient asked if I could adjust her chair. Gladly, though the recliner chair that she was using, I couldn't find the levers. I had looked everywhere on the chair and I couldn't find the levers. So I just started pushing on the leg part while watching her legs, but she insisted, she wanted me to do it the proper way of using a lever. She's like, there's a lever on the side of the chair. I'm like, oh, could you show me, because I couldn't find it. And she didn't know where it was. So I asked the nurse, how do you adjust? I went out to I walked about 100 feet, and the nurse's station was right near the room, and you can see the room clearly. It was open. I walked up to two nurses who were talking, and they were not talking about work. They were talking about something off of work, which is perfectly fine. But and maybe that was my error. I had thought, okay, it's okay for me to intervene as they're talking about where they stayed the other day. That's fine. And please, so please do give your suggestions on how you would handle the encounter, because I don't at all mean to disrespect anyone, and I hope they didn't find it disrespectful. But so this is a lesson learned and lesson to be learned. So please do share your comments below, especially if you are a nurse and have such experience. Please do share what is the best way to approach you as you're working, because I in no way mean to disrespect, and no one else would want to disrespect anyone. So please do share in the comments below what is the best way to get someone's attention, and to ask for help and such. Because we all are team players and want to do what's best for the team. So I came up to the nurses and I asked, oh, excuse me, pardon the interruption, could you show me, I didn't ask could you show me, but I said, the patient is asking for to adjust their chair and I'm having some trouble figuring that out. Could you tell me how to adjust the recliner chair? And the nurse gave me a very strong look, a pretty heavy stare, and had said, use the lever. And I said, oh, yes, I must be missing it because I couldn't find it. And she said, it's on the side of the chair. And I thought, oh, okay, well, I must have missed it. By the time I went back to the room, the OT came back and I had asked him, oh, could you show me where the lever is? He also didn't know where the lever was, so he just pushed the chair down, which is what I initially tried, but the patient didn't want that. So, you know, lesson learned, you also have to keep in mind your own time and do things that make the most sense at the time. So take that as you will. And then the nurse had come back into the room, or had come to the room with another nurse, which I believe that was a nurse who was in charge of this patient. And I thought, that's a little peculiar. Why does she need to be here? But I thought, okay. And then so the nurse, who I had originally asked for help, had said, do you know how to lower the tables that were attached to the recliner chair? So there's 2 tables on the armrests of the recliner chair. And I asked the patient, oh, do you want that adjusted? And the patient said no. But the nurse insisted that I adjust it. She said, show me how you adjust it. And I thought, oh, okay, well, this is a good learning opportunity. Okay. And then so I was like, oh, sorry. She had said, would you like some help adjusting the table? And I said, okay, sure. That'd be great to, if you could show me it. And the nurse did not, that was not their intention. Their intention was, though they asked, would you like me to show you? They had said to find the lever. And I'm like, okay. But right now, because I was thinking right now is not the best time because we're trying to get the patient up out of the chair. So I'll try it another time. No, that is not what she wanted. She wanted me to do it right then and there. And I said, well, it would be helpful at this very moment if you could show me how to do it since we're trying to work with the patient. And the nurse glared at me. For lack of better words, I received a very strong glare. And she turned to the other nurse and said, this is going to be fun to watch. And I thought, well, that's a little interesting to say in front of the patient. So I admit, I was still like, please feel free to show me. And again, we're still helping the patient up from the chair and got the patient up out of the chair, and the nurse still looking at me. So I'm like, okay, I will be watching the patient, have one hand on the patient, and not be looking at the table, but have my hand fidgeting with the table. This is running a risk for the patient, and I don't know if you understand what you're doing at this moment, thinking this to the nurse, but you seem very, very unsatisfied with my responses to you, so I will do this. And so I had adjusted the chair. I tried to adjust the table and I couldn't figure it out. And for a good 2 minutes, which sounds ridiculous because we still have the patient standing there. And I laugh because, I mean, guys, I have to say this was something that is very, very, I admit, even I didn't see this coming. And so she stayed there for a good 2 minutes. Well, no, it was more like 5 minutes, but the nurse stayed there. And then after a good 2 minutes, she's like, give up. And she said it in a much more snarky way. And I said, I'd love for you to show me. And so she came over, slammed the table down, and left. And I honestly didn't even get to see how she did it. She did it too fast for me to see. And the other nurse looked very, very uncomfortable. I felt so bad for the other nurse. She looked really uncomfortable being with that nurse because she just stood there not knowing why she was there. And I have to say, I completely understand that people have difficult times, and the reason I'm sharing this story is because I didn't at all take it personally. I understand that it helps a lot to keep an open mind, and I definitely kept an open mind and open heart. But the hardest thing was that you're doing this in front of a patient. You're doing this in front of a person who just had experienced trauma. It's not appropriate. I'm usually not this sharp in my words to say something like it's not appropriate, but no, it is very uncomfortable for the patient and for the rest of the team. And again, this story is not at all, not in any way relevant, representative of all medical staff, healthcare staff, any staff. It is an acute situation. It's hopefully just one of those moments. To be honest, it didn't quite look like it because this nurse seemed to it seemed like a behavior that has been witnessed before. Please, everyone goes through a hard time, and I'm so sorry for the trouble that you may be experiencing, but please be cognizant. Always be aware of the others who are being affected, because fortunately the patient was not caring about that. The patient was focused on having herself get up because she needed a lot of assistance getting up, and even to adjust the chair gives you some insight into the fact that she needed a lot of help. And for me, I mean, on my end, it may have been better to even dismiss what the nurse had said and to hold my constitution that I'm like, not right now. I will adjust the table that the patient does not want adjusted, but I'll adjust it for your satisfaction another time. I will not do that right now. So that is also something that I've learned to hold constitution to. While this is a nurse, dare I say someone who knows a place much better than I do, I did feel a power struggle that was trying to be kept in place, and I don't think my reaction to heed to her orders was the best at that time. Now again, this is not in any way relevant to everyone. No. I am sure many of you have experienced stuff like this, and it's not just in the healthcare field, it's anywhere that there may be those power dynamics that you have to face. And for you who is in the lower end, who do your best to hold your ground, because you do what is best for the patient, or best for whoever you're serving, or best for your current situation, circumstance. And I would love to know anyone else's stories on this. And also, I want to reiterate that it is very understandable that that everyone goes through times that are tough, and it is not about the person. So in no way am I upset at the person, the nurse. And I'm not upset really on my end. I'm not upset of anything that was directed towards me, because again, it's probably something that within the dynamics of her own like background and such, there's been things that she's had to deal with, and I completely empathize, and I feel for her, and I felt for her, and I felt very sad that she probably went through a lot of hardships. But I do truly ask that patients are not involved, affected, that patients are not affected by this I'm biting my lip here because I'm like, how do I say it? Not affected by negativity that can come out. Alright, so thank you everyone. If you liked this video, or if you found it something that resonates with you, please do like the video, subscribe to my channel, and share, comment on any other experiences you've had or what you thought of this situation. Alright, so I'll talk to you later. Bye bye!